One of the new technologies that EMS and that physicians in the emergency department are using a lot more of is an interosseous needle. Part of it is just it's so speedy. You can just pop one of those in and have access right away. And we see a trend towards using interosseous needles in place of central lines. But one of the issues that comes up time and time again is whether or not we can confirm that that IO is actually in the right place. And ultrasound allows us to do that right at the bedside. So what do? We've got the IO in place and we just do a little flush, and then we use our color Doppler to look for that flush underneath the cortex. And we can do this in transverse, or we can do it in longitudinal plane. So when is that going to be helpful? It's going to be helpful if we've had an IO in place for a long time and we want to make sure that it's working well. It's going to be helpful if we've had a patient transported. Perhaps it's bumpy in the ambulance or bumpy in the plane or the helicopter and it could have come dislodged. Or even if we just put it in initially and we want to make sure it's seated properly within the cortex. And you can see the obvious advantage in using ultrasound to make sure it's in the right place, as opposed to waiting to see if the soft tissue swells or cutting through all of the tape that someone's used to wrap it in. So again, think about point of care ultrasound and confirming your interosseous needle placement. It's going to be a nice way to do that easily and effectively right at the bedside.